It's Thursday, May 7. Good afternoon. I'm Herman Green with the Midday News. If you're watching online at onespotmedia.com, a very special welcome to you. Thanks for joining us. 3 communities in St. Mary have been put under lockdown due to the COVID-19 outbreak. The communities are Dover, Enfield, and Anato Bay. The residents awoke this morning to the startling realization that their movements will be restricted for the next 14 days. The quarantine took effect this morning at 6 o'clock and will end on May 21 at 6 a.m. The Ministry of Health says the decision to restrict movement is as a result of 13 people having tested positive for COVID-19 in the communities. Now, the ministry says its investigations show that there were considerable movement of the affected persons, which has increased the risk of exposure to all persons in those communities. The ministry says it also took into account that the exposed persons in the communities may develop infection and cause spread to other members in the communities, which may result in a rapid increase in the number of positive cases. Now, this is due to the high movement of persons within the affected households within the communities, the high population density of the communities identified, and the high vulnerability of persons within the communities to severe illnesses due to the age and other socio-economic factors. Now, the ministry says it will carry out further testing of members of the communities, closely monitor members of the communities for the development of symptoms, and educate the residents of infection prevention and control measures. Stay-at-home orders designed to contain the spread of COVID-19 are having an impact on testing for the disease. The challenge was outlined by Chief Medical Officer Dr. Jacqueline Bissesa-McKenzie, who also said steps are being taken to rectify the situation. Dashan Hendricks tells us more.
The government has been telling people to stay at home since the COVID-19 outbreak in March, and it appears that the effectiveness of that messaging is having unintended consequences in the fight against the coronavirus disease.
Because of the stay-at-home policy, what we have been finding is that there have been decreased visits to our health centers and, as a matter of fact, to our hospitals. As a matter of fact, I think that we are seeing probably maybe about 50% in some instances fall in the number of visits to health centers and to hospitals. As a consequence of this, we are getting less cases of respiratory illnesses that are presenting to hospital, especially the mild cases who may be staying at home.
Dr. Bissesa-McKenzie says the testing protocol for COVID-19 was designed to pick up the most cases from where they are likely to come. That is from persons who are contacts of confirmed cases or persons with respiratory illnesses, as well as through surveillance programs across the island. To overcome the challenges the stay-at-home order is having on that work, the Chief Medical Officer says a concerted effort is being made to get those persons tested by asking them to make contact on the Jam COVID website to make appointments for testing.
It is not open up to the general public per se as to if you want to get tested, you get tested, because you're going to be screened through this site as well. And we're going to see if you are the person that needs to have a test done. Because essentially we want all the people who needs to be tested.
She says with the backlogging testing now cleared up, the health ministry is also reaching out to private practices for help in getting samples from the specified groups for testing as well.
We have collaborated with several of our general practitioners, and our health centers through our health departments or medical officers of health are open to this for the general practitioners to make contact to say that we have patients that we can arrange to come in at a certain time, or if it is that we can just direct the patient straight to the health center to have the testing done. And that has been taken up by our general practitioners right across the island. We have seen an improvement in that. But we continue to expect that the numbers will increase from that as well.
Dashan Hendricks, TVJ News.
Meanwhile, Dr. Bissesa-McKenzie says the move to test everyone who is admitted to hospital is to bring more credibility to the testing numbers.
Don't want to see at the end of the road is for persons to ask, have any of the other persons who have died in hospital, could they have been COVID positive? So that is why we are moving to test all our admissions to hospital. So that will help us to understand, because there is a relationship between the case fatality rate and the number of overall cases in your country. There is a relationship based on what we've seen across the world. And so therefore, if you know that you're seeing a case fatality rate that is in keeping with what your expectation, you know that your testing is adequate.
And with a number of asymptomatic people testing positive for COVID-19, the Health Ministry will be doing antibody testing. Asymptomatic people are those who have COVID-19 but do not show any symptoms of the disease. Health Minister Dr. Christopher Tufton was speaking at Tuesday's press conference.
We have ordered the antibody tests, right, CMO, and that we intend to administer that test along the appropriate levels of protocol as explained by the Chief Medical Officer in short order.
The Health Ministry is now testing to know if COVID-19 is active in a person's system. With antibody testing, it will show if people had the virus before. Chief Medical Officer Dr. Jacqueline Bisesa-McKenzie says health officials have to be careful.
Even in using antibody testing in countries, and many countries are looking at that, even in using that to determine is it that the population is at a safe level for us to now open up, you have to be cautious because you don't know the level of the immunity that persons will have. So the value of antibody testing is really to determine at this stage what was the prevalence of the infection within the country.
Dr. Bisesa-McKenzie adds that the data will be analyzed to ensure the antibody test results are not from other coronaviruses, such as the one that causes the common cold.
With the cooperation of our National Public Health Lab, we are going to be looking at samples that have been taken of the population over years. And we're going to be looking at this antibody testing and the results in those cohorts of persons to be able to compare any results that we have now coming out of this antibody testing that we're going to be doing on these persons who we think have been exposed to COVID-19, so that we can get an accurate picture of what it is that is happening in the country.
More than 100 Jamaicans arrived in the island from the United Kingdom yesterday. This is the first set of Jamaicans allowed in following the government's protocol for a controlled re-entry of its citizens. Vashon Brown tells us more.
The 43 Jamaican crew members who was stuck on the Morella Discover 2 cruise ship has expressed relief that he's back home. Jerome Cameron spoke to TVJ News shortly after he was processed at the Norman Manley International Airport last evening. Mr. Cameron and more than 100 Jamaicans arrived on a flight from the UK.
So what does it feel like coming home?
Well, great, man. Like we're at sea like for almost 70 days. I feel great coming
What was
home.
that feeling like being at sea for so long?
Wow. Well, I mean, like we were close to coming home when we were in port. I think I don't remember when, but
April 2.
April, yeah. From that time, yeah. We were beaming to come home from that time on. So I mean,
do you have any objection to being quarantined?
objection to be in quarantine, like I mean for 14 days. If they check us like for 5 days and we're COVID free, I mean send us home.
The Morella Discover 2 was in Jamaican waters for refueling on April 2 when a request was made for the group to disembark. It was reported that the vessel left before the government's approval could be conveyed. The Jamaicans who returned to the island yesterday will be placed in quarantine. This is a requirement for nationals who've been stranded abroad due to Jamaica's borders being closed to incoming passenger traffic since March 24. Meanwhile, attorney Jennifer Hosen, who represents some of the Jamaican crew members on the Morella Discover 2, says legal action against the state is still being considered.
Certainly these are persons who have had their rights infringed by the government of Jamaica. If nothing else, what we saw was a blatant disregard by the Jamaican government of Section 13(3)(f) of the Jamaican Constitution. And if it is that the state is going to infringe the right of a citizen, which causes the citizen harm and distress, as it did with these persons, then certainly they stand a good chance of maintaining a successful action brought against them. So as far as I'm concerned, and if the time comes, certainly after the quarantine, to sit with my clients, then certainly we will look at that aspect, and it is a very real possibility at this juncture.
Vashan Brown, TVJ News.
And we now take a break here on the Midday News. We'll be right back. Welcome back, continuing the news. The Ministry of Local Government and Community Development is reporting that since the start of April, it has spent approximately $236 million in its COVID-19 response measures. Permanent Secretary at the Ministry, Marsha Henry Martin, says the initiative is specific to infirmaries and homes island-wide. According to Mrs. Henry Martin, the bulk of the money was originally for a conference that was scheduled for this year, but has been postponed due to the COVID-19 pandemic. As a result, the money was reallocated to help in measures to fight the spread of the virus. She gave details at yesterday's Public Administration and Appropriations Committee meeting.
We would have commenced activities in respect of assistance to the elderly, outdoor poor, and the registered poor children, as well as in terms of sanitation and cleaning of the respective infirmaries and golden age homes, and the engagement of temporary workers for screening, cleaning, and sanitation, and also sought to acquire thermometers that would aid in the screening process.
She also said the ministry has launched a homeless initiative which is geared towards cleaning areas frequently occupied by homeless persons.
Cleaning and sanitization of common areas where we have observed that the homeless would usually accommodate or congregate, and also special feeding programs within the KSA.
Water, an essential commodity, especially during the COVID-19 pandemic. The washing of hands and proper hygiene practices are important, but residents of one St. Thomas community are still without it.
No water! No water! No water! Oh, we must survive!
This is the cry of residents in Ailers Valley, Scotland Gate early this morning. Residents say it has been months since they have received any water in their pipes, forcing them to travel miles to get some. The effort has even resulted in injury for one resident.
Up on bush me have to go. I try to get some water on the cow. Same place where I take the water, there the cow them a come to drink. And I saw the cow get to drag me and break me on. No water we now have, and the crisis rough on we man.
But for the elderly with illnesses, traveling to find water is a hard task. The lack of water is also affecting farmers whose livestock are dying. And for others, this is a spring they are getting water from.
We need water. We're suffering for water around here. See what we have here, use, drink, wash, cook, clean. This more if we give it COVID than to help COVID. You understand? The chicken them are dead off in my coop. I can't even feed them at daytime because I don't have water to give them. I can't wash and I can't bathe.
And the water truck has been a rare sight.
Started up coming is 2 weeks since the truck carry liquor water. Since the truck bring liquor water into this crisis, the tank, we have a tank here, it is dry. The catchment, dry. How we must survive, Mr. MP?
However, residents say even if the catchment had water, it is extremely dirty.
The tank not cleaning. If you say that liquor water can't come out, the tank not, the water not taking care of the right and proper way. Me don't even see nobody coming at the district to come test the water like one time. You used to see the help people then come test the water every month. You don't see that go on again.
Shortly after, their pleas were heard. A water truck showed up and residents were allowed to fill their containers. However, it is still unclear when water will be restored to their pipes. O'Shane Masters, TVJ News.
2 children are dead after they were shot in Denhamtown, Kingston yesterday. They have been identified as 8-year-old Toya Brown and 15-year-old Nyron Taylor of a Tivoli Gardens address. Toya was killed at her house on Dumfries Street. It's reported that sometime after 5 in the evening, a man walked up and shot her on the veranda. She was pronounced dead at the Kingston Public Hospital. Earlier, Nyron was shot on Last Street. Up to news time, the circumstances which led to the incidents were still unclear. Meanwhile, there were reports of another fatal shooting along Penn Street in Jonestown. We go down to sports. Reggae boy Leon Bailey could be the first Jamaican international to be back on the playing field by the middle of this month after the Chancellor for Germany, Angela Merkel, gave the green light for the resumption of the German Bundesliga. It will become the first major top-flight league in Europe to return to competition, with a date for resumption to be confirmed by the German Football League later this week. However, all matches will be played behind closed doors. And that's where we wrap up the Midday News. I'm Herman Green. Please join us at 7 for the primetime news package. On behalf of the News, Sports and Production teams, good afternoon.